that. Well, welcome to TCU Pulse Check, the DNP Edition, where we explore the power, purpose, and pulse of the doctor of nursing practice.
We bring you conversations with leaders who are shaping healthcare, advancing practice, and redefining what it means to lead as a DNP.
I am Dr. Kimberly Posey.
And I am Dr. Paul Biluan.
Today, we are so excited to welcome a national leader in nurse anesthesia, research translation, and health policy. Our guest today is Dr. Dru Riddle. And Dr. Riddle, he is a professor at Texas Christian University in the School of Nurse Anesthesia, and he also serves as director of the Center for Translational Research. He is a practicing CRNA and has held numerous leadership roles, including serving as president of the American Association of Nurse Anesthesiology. He's also a fellow of the American Academy of Nursing, and he currently serves on the Texas Board of Nursing. Dr. Riddle, welcome to the podcast.
Yeah, thanks for inviting me to be here. It's a pleasure.
Good morning, Dr. Riddle. And today, Dr. Dru, many of our listeners, can I call you Dru?
Absolutely, please do.
Thank you. Dru, many of our listeners are DNP students or aspiring nurse leaders. Can you tell us a little about your journey into nurse anesthesia and what led you towards leadership and research?
Yeah, my career started in nurse anesthesia 25 years ago. I actually went to nursing school because I learned about CRNAs and what a CRNA does while I was in undergrad studying biology, not sure what I wanted to do with that degree. Had an opportunity to connect with a CRNA and see what he did and how he cared so intimately for his patients, and decided that that was going to be my career. So I applied to nursing school, luckily got in, and have been a CRNA now for 25 years. And leadership was not anything I sort of aspired, as I was an undergrad student or even in CRNA school, like I'll be the president of the AANA someday, or I'm going to sit on the board of nursing or something like that. It really was in response to various, I don't know, things that came up, issues that I thought, gosh, I think I have a little bit of a voice to offer here. And then networked with the right people and got connected in the right ways that ultimately allowed me to grow into some pretty awesome leadership opportunities, I guess.
That's awesome, Dru. Thanks for sharing your journey. What point in your career did you realize you wanted to influence practice at a broader level?
Yeah, I learned that or realized that actually very early on, even in my undergraduate nursing education. I distinctly remember sitting in a pharmacology class in undergrad nursing. I don't mean to give everyone PTSD, but I'm sure those of you that have lived through undergrad nursing pharm can possibly relate. And I distinctly remember being taught some things, thinking that doesn't seem right. I was a paramedic, not that I knew a whole lot about pharmacology, but sort of the way things were being taught in the classroom didn't quite add up to at least what I saw in what I'd call the real world. Very quickly, the next semester, did my externship as a senior nursing student and critical care, and saw right then and there that what I was taught was not accurate. And it was at that time I thought, wow, if I hadn't picked up on that, I actually could maybe even hurt somebody had I done something the way that I was taught. So this idea that we need to translate evidence into practice and ensure that our practice is based on the best available evidence started way before I even knew how to define that in my junior year of nursing school, and it's sort of been the cornerstone of my career. All of the decisions I've made professionally have been based on sort of that premise of how can I make sure I help the outcome for patients, right? Even if it's a very small way, how can I make sure that they have the best possible outcome based on the evidence that we have available?
Yeah, thank you for that. So, taking that a step further, of course, you've worked across the clinical practice, this research translation, your national leadership. So, Let's take that with the DNP. From your perspective, with all of that background, what makes the DNP really unique in advancing healthcare practice?
Boy, I would say the DNP clinician is so, or leader is so well prepared to bridge that gap between real life practice and let's be completely honest. We know what perfect looks like, and then we know this is what reality looks like. And of course, we're not cutting corners, we're not harming patients, we're not putting patients in danger, but there are times when what the epitome of perfection looks like and what we actually can do at the clinical setting, there's a gap there. And I think that gap is where the DNP prepared nurse is perfectly positioned to be able to help navigate some of that. I have my PhD as well, and so I'll pick on PhDs a little bit. Kim, I know you do also. But there's sometimes a little bit of a disconnect in some of the research. And we've all read a study or a paper, and you're like, well, that's interesting, but there's no way that could actually be done in reality, you know? So, I suppose that the staunch PhD elitist, I'll say, are going to say, oh gosh, it has to be this way. And I think what the DNP does is say, well, I understand why you're saying it has to be done this way, but the reality is that can't happen. So how do we make it happen as close as possible or in a way that makes sense contextually for our patients, for our setting, for our socioeconomics, whatever that may be. And so that's where I see the value of the DNP. And to my knowledge, there is not another healthcare professional degree that teaches us to think the way a DNP does. Not the MD, not the DDS, not the PharmD, not the DPT, et cetera, et cetera. That's not a slam against any of the other professions, but it's just very different and appropriately different. We all have different roles.
I think that, really translates well into this research center, the translational research. So tell us more about that. And so, how does that Center for Translational Research really help clinicians struggle with putting that into the real world change as you've described? Because we do know that, it's hard to really explain what the DNP does, but for translational research, is it only for nurses, or tell us more about that?
Yeah, great question. So it absolutely is not only for nurses, it's an interdisciplinary center, and we focus on primarily on training and producing systematic reviews. So rarely does one study or should one research study change your practice. We all did undergrad research, or maybe you're in a graduate level research class right now, and you learn to be critical. I think we're sometimes too critical, but that's another conversation. But we learn to be critical of research, which is appropriate. And the problem is, if I'm not critical and I only read one study, well, the outcomes of that study may actually be very different than 8 or 9 other studies that asked a very similar kinds of question. So, the Center for Translational Research, we focus on taking multiple different studies and amalgamating or putting them together in something called a systematic review, which is a type of research methodology. Systematic reviews are often composed of multiple, sometimes a few, sometimes dozens, and even hundreds at times, studies that answer a similar kind of question. Those systematic reviews are then distilled down, and ultimately they form the foundation of clinical practice guidelines. And so most of us are very familiar with practice guidelines on, fill in the blank, whatever it is your specialty on, whether it's breast cancer screening or juvenile diabetes and everything in between. And that is what systematic reviews do. They help inform professional societies, organizations to make those kinds of recommendations. That, in my mind, is exactly what the DNP prepares people to do and what we should be doing as DNPs. We understand the research, but we also know how to apply that research at the point of care. I give the analogy all the time. I can read 8, 10, 12 studies, but I'm taking care of a patient having an emergency C-section at 3 o'clock in the morning, and I'm the only person in the hospital that knows how to do anesthesia. I need practical, implementable interventions that I can use to help take care of this patient because that's going to make a difference in that patient's outcome. And that's what that translating research, the impetus of our center is that exact thing.
Thanks for highlighting the importance of systematic reviews and laying foundations for practice guidelines. I'm a practicing clinician right now, so those practice guidelines are, you're right, very important for me. I need something that I could implement at the moment versus going through research and stuff when I'm practicing. So if I'm a DNP student and I want to get involved with projects like this, like systematic review, how do I start? Do I need mentorship process? Do I need to enroll in a school?
Yes, so at TCU, if you're in in the program here, luckily we have the center right here on campus, so you can get in touch with me or some of the other folks that do this kind of work within the center. Systematic reviews are very different than a literature review. Many of us, all of us, have written some sort of literature review. You do a search for some evidence, you pull 5 or 6 or 7 studies, you sort of summarize those studies and come up with a with some sort of conclusion. Systematic reviews are highly, highly rigorous, super methodologically difficult, quite frankly, to do. They're always done as a team, and usually that team is 6, 7, 8. I'm involved in one right now. There's 12 of us that are all each bringing a different thing, if you will, to the table as to how we contribute to the review. So if you're a DNP student and you're interested in this idea, I would get in touch with your faculty in your program to find out if your faculty already have that expertise and are in the process of doing that. If they're not, then reach out to us at our center. We often have systematic reviews that are ongoing or maybe in the inception phase, but the trigger hasn't been pulled yet to see if we can get you plugged in. Don't try it by yourself. You do need mentorship. And I think that mentorship comes from practicing clinicians, from researchers, from epidemiologists, statisticians. There's lots and lots of really good folks that are involved in these things.
I think the most important thing there is don't try to attempt it yourself, because systematic review is a high level research that we do as DNPs. But Dr. Kim?
Yeah, thank you. So, yeah, I agree. And I think there are some classes for some people too, right, that can take on systematic reviews if they're willing and wanting to learn more. Is
Yeah,
that
absolutely.
correct?
Yeah, there
Yeah.
are. We offer them here at TCU, and there are multiple centers throughout the U.S. Geographically, there may be something closer to where you are. JBI, which is used to be called the Joanna Briggs Institute, but now JBI probably has the best systematic review training, in my opinion. We are affiliated with JBI and the Cochrane collaboration here at TCU. I think quite frankly, JBI's training is far better. There's lots of different JBI centers in the US, and you can just kind of Google JBI systematic review training and find out, if there's a course coming up, in your area. A lot of them are done online, some of them are hybrid. Most of them are face-to-face, which we find to be a little bit more successful.
Thanks for sharing that. So hopefully some of our listeners will look more into and dive into that a little bit more. There's other amazing leadership roles that you've had. Can you talk to us about what you do on the board of nursing and how that is also influencing your healthcare policy?
Yeah, so I was appointed in 2003. In the state of Texas, members of the Board of Nursing are appointed by the governor. So I applied and went through the vetting process through the governor's appointment team and ultimately received an appointment and confirmation by Governor Abbott. And then we have to be confirmed by the Texas Senate. And so the state Senate has to confirm gubernatorial appointees to the Board of Nursing. All that to say, I represent advanced practice nursing. I'm one of of 2 nurses on the Board of Nursing that represent APRN practice. What that means is if an issue related to advanced practice nursing comes before the board, myself and my colleague, who happens to be our board president, Kathy Shipp, who is a family nurse practitioner, we tend to be the ones that weigh in on those issues because that's our area of expertise. However, the Board of Nursing is composed of registered nurses, practical nurses, advanced practice nurses, and members of the community, members of the public that all have an equal vote. So I've often been asked, like, oh, well, if this is an APRN issue, don't you just get to decide? And the answer is no. I'm one vote on a board of multiple people that all collectively make a decision. It's been very interesting and eye-opening to see how our practice is regulated at that regulatory level. It's interesting to see how rulemaking happens, how the board thinks about discipline and eligibility for licensure. I've learned far more than I think I've contributed to the board, to be quite honest. The other thing that I've taken away from the Board of Nursing experience is how absolutely amazing the Board of Nursing staff, the people that work full time for the Board of Nursing, whether they're other nurses, licensing professionals, investigative professionals, attorneys. These folks, many of whom are not nurses, care deeply, deeply about nursing and the health of folks in Texas. So it's been very interesting and eye-opening to sort of see how it all unfolds behind the scenes a little bit.
So for our like DNP students or other DNP listeners out there, how can they get involved in policy? Or, how do they take that step? Because it seems so, difficult, scary, right? And how do you break that down where you can start to get involved?
It does seem sort of overwhelming. And honestly, it to me sometimes it feels defeating in the sense of like I'd like for this thing to change, but in order for this thing to change, we need a whole bunch of people to vote in a certain way, and those people aren't voting in this way. And so it almost is like, well, I'll just sort of give up. And so what I say, and the way I began my sort of health policy advocacy was quite frankly at the very local level. And what I mean by that is the operating room in which I practice anesthesia in the hospital where I work. And how can I make incremental, policy level kinds of changes simply around things like clinical care? I'm an expert in that, at least I think I am, and maybe a bit of a voice within my own department. And so that then grows into, well, maybe that becomes a facility level kind of thing. And if you work for a health system, maybe that's multiple facilities, or it gets adopted by a local, regional, even national organization. All of that cannot happen without other people. So my advice, I have our CRNA students come in a lot and talk about, well, how can I get involved and what should I do? The number one piece of advice I was given years ago and I would give to them is grow your network. Begin to talk to people within and outside of your area of expertise. Don't surround yourself by a bunch of people that think and do exactly what you do. Although it's real comfortable to be around a bunch of nurse anesthetists because we all sort of do the same thing and talk about the same things. It is far more productive to have a small group of nurse anesthetists along with all of the other APRN roles or our physician colleagues or the healthcare economists, or you go down the list of these folks. So grow your network, and you can grow it in so many different ways, whether it's in an online platform, social media, but then beginning to involve yourself in the business of healthcare outside of just a clinical piece. There, whether that's meetings at chambers of commerce or hospital associations, and growing your network is going to get you plugged into people very quickly.
Thank you for highlighting the power of networking and collaboration, which is really important nowadays, especially with social media. It's so easy to network. Dr. Dru, many of our listeners are current DNP students or early career leaders. What advice would you give them as they prepare to lead in today's healthcare environment?
Be adaptable. Any of us in the healthcare space knows the rapid pace of change, whether that's because of reimbursement, because of practice changes, because of the opening and closing of a facility, a merger, an acquisition. I mean, you can go on and on and on about the why it's happening, but we have to adapt. We have to be able to adapt to that changing environment. And as a burgeoning or new leader, that can feel very difficult because as the leader or someone who's aspiring to that leadership, you're the person that many people may be looking to help navigate that change. And if you yourself are not adaptable or at least willing to embrace the change, then the people that you're surrounded with or the people that surround you are often going to sort of feel the same way. And so I think without being able to be adaptable and understanding that the system is fluid and we have to navigate our way through it, you can get very, very frustrated very quickly. We set up this thing and we rolled it out and everything was ready to go, and then they changed something. I don't know who they are, but they do a lot of bad things in healthcare, right? They changed something, and now all this work is for naught. Well, let's reframe that a little bit. We did this work. We can't implement it this way, but it doesn't mean that the idea, the knowledge is not, it doesn't go away. How do we adapt what we did or adapt what we're thinking to fit this new paradigm of whatever the proverbial they said is going to happen?
Thank you for that. Yes, adaptability, that is extremely important. And so all of these skills with translational research, adaptability, how to get into policy, networking, those are all super awesome tips for our aspiring DNP leaders. But if we take out a broader look, let's go out, let's say, over the next decade. So, what do you think is the biggest opportunity for nursing leadership if you have your crystal ball?
I think we're going to see nursing leaders in non-traditional leadership roles in the next decade or so. And what I mean by that is often in nursing, we think nursing leadership, maybe that's the nurse manager or a supervisor or a nursing director or a chief nursing officer, all of which require someone with a nursing license to do. The hospital CEO does not uniquely require someone with a nursing license. The director of CMS, the director of FDA, the director of the CDC, the individual running your state health department or your local public health outreach community center doesn't necessarily require someone to be a nurse. However, I think in particular, DNP prepared nurses are so well equipped to be in those roles. I think in nursing, if I think about my career, when I was working in the ICU as a nurse, and then for the last, number of years as a CRNA, I think arguably nursing touches more of patient care than any other discipline, any other profession. We are with that person eh, nonstop from the moment they enter the healthcare world until they leave the healthcare world. And I think as DNP prepared nurses, we know that nursing care piece so well. Now we're armed with all of this information on understanding and appraising and applying research and best practices. That's someone who can run a Fortune 500 company who happens to be coming from that nursing lens. So I would encourage you all to think beyond the traditional leadership roles that are designated for nurses. Use your nursing training and experience to go completely outside of that traditional. Maybe it's not even in healthcare, right? Maybe it's in the insurance space or biotech or not related directly to a hospital or a clinic or an outpatient setting. So that's where I see it within the next 10 years. I don't think you can talk about 10 years and not talk about AI. I don't know how AI is going to or not going to play into this whole thing. It's not going to replace bedside critical care, bedside critical thinking. And so while it may augment or help us, I think nurses are very well positioned to be leaders around how AI gets integrated leadership into clinical care, into decision making, et cetera. So I just had to throw out AI because it's out there, right? We all are using it in some way, shape, or form.
One more thing for me, Dru. Tell me a book or resource that influenced you.
A book or a resource that influenced me. I've read a lot of sort of how to be a leader when I became in these sort of leadership role. It's interesting because there's so many different philosophies or thoughts or ideas out there around how one leads people or teams. And I don't know that any of them were incredibly useful. There were bits and pieces of this one or that one. I think probably the one that resonated the most with me was a book called They Smell Like Sheep. And it is a biblical based leadership. Myself, as someone who practices Christianity and faith is very core and center to who I am as an individual, it really resonated with me around how I could take biblical principles and apply those into everyday leadership roles. So it's an interesting read. It's a little bit esoteric at times, quite frankly. I glazed over a little bit, but They Smell Like Sheep is I think an interesting off the beaten path leadership kind of book that might be interesting to some folks.
Thank you for all of this. This has been, an awesome talk with you, and really hearing your perspective, that you've crossed, so many different realms, and, all of your national leadership. I know you have a lot to offer, and we appreciate all of that. So thank you so much for, sharing your insights, your leadership and advancing the evidence-based practice, and continue really to shape the future of nursing.
Thanks for having me. I enjoyed our conversation.
So thank you for listening to the TCU Pulse Check, the DNP edition.
And if you enjoyed this episode, be sure to subscribe and share it with colleagues and future nurse leaders.
Yeah, so until next time, stay connected to the pulse of nursing leadership.